Welcome, everybody, to today's edition of the Agenda 2025 conference at the Foundation for Research on Equal Opportunity. If you've been with us throughout the last 2 weeks, you know that the purpose of Agenda 2025, this project, is about trying to define and develop an equal opportunity free enterprise agenda that the president who's inaugurated in 2025 can take to his office or her office and enact as president, hopefully with a Congress that agrees with it. So today, our topic is healthcare, specifically a very interesting new bill sponsored by Senator Mike Braun and Representative Bruce Westerman, who are with us today, called the Fair Care Act, which is an attempt to come up with a free market approach to universal coverage. And we did a lot of work, I should say, in technically advising both these members on this bill. It's their bill. It has a lot of their ideas in it. And it's also very compatible with the principles of health reform that we've been talking about for many years. And I'm going to just create a quick slide. I'm going to show you a quick slide that shows those principles so you can get a sense of what the goal of free market health reform should be in our view. So bear with me as I share a screen here, or I'm going to try to anyway. So the basic idea here is, look, you want to have health insurance or health reform that's affordable for every generation. You want to have a plan in which every American can afford health insurance today, but also a system in which whatever we do with healthcare is affordable for future generations. If you make healthcare free or cheap for everyone today, but you create a system that adds to our debt and deficit, you're only going to make the system unaffordable for our kids and grandkids. And we should have personalized insurance, not a one-size-fits-all system where everyone has the same plan, but a system where you can choose between dozens of insurers that are competing for your business and trying to come up with a plan that suits your needs. We should have fairness for taxpayers, meaning like right now, all of us on this call, we're paying taxes so that very, very wealthy people can have government subsidized health insurance in the form of Medicare. And that's not fair. Like, why does Mitt Romney get government subsidized health insurance? Why does Warren Buffett get government subsidized health insurance? They can afford to buy their own insurance, and yet we're paying taxes to fund their insurance. So let's make the system truly progressive and reserve taxpayer-funded subsidies for those who need it. And finally, let's have a system where there's real competition. Too often in our healthcare system, there are monopolies that block competition and block true innovation. The more we can dislodge those monopolies, the more we can reduce patient costs and increase innovation. So with that as our general framework for health reform, I want to introduce our principals here, Senator Braun and Representative Westerman, who put together this bill, the Fair Care Act of 2020. It's a new version of a bill that Representative Westerman introduced last year called the Fair Care Act of 2019. This version is significantly improved or enhanced compared to that last version. I'm going to bring in first Senator Braun. Tell us a little bit about what motivated you to launch a health reform effort and introduce a health reform bill in Congress at a time when a lot of people try to hide from the issue of health care on the Republican side.
So I saw your four main points there, and I agree that all of them have to blend together to end up giving us what is going to work today and be scalable and sustainable into the future. But I'm going to focus on the last of the four, and that was bringing competition and also engaging the healthcare consumer, who, in my opinion, has gotten used to a very paternalistic delivery of healthcare. And I'm going to tell the story of what I did in my own business in terms of how that might work and what it's done for us. So when you talk about free markets being robustly competitive, there are a couple, two or three, maybe four things that have to be in place. You have to have an engaged consumer that's got the full range of information. You can't have any barriers to entry. There can't be crutches built in by lobbyists that give, one business, one sector an advantage over another. You also need to have easy entry, and it's got to all be blessed with full transparency for the benefit of engendering competition and letting consumers take advantage of it. So 12 years ago, 2008, we were coming through a rough year in general. We decided to take on changing the paradigm in our own universe. What we were was a company of about 300 employees. I'd been only 15 employees from 81, I think, through 98. We grew from 15 employees to 300 in that 10-year span. And I never worried about the cost of healthcare because it was kind of an affordable fringe benefit when you go back into the 80s and the 90s. That was changing dramatically. And what I did to remedy it was you only had two variables at your disposal. And that's when it wasn't in the C-suite, it was still out there as a sideline item of interest that now was starting to nag more. You'd raise your deductible to moderate premium increases, and you'd change underwriters. It worked really well until we got closer to 10 to 12 years ago. I had already risen to a $5,000 deductible back in 2008, and I wasn't going any higher. We pay the highest wage in the lowest unemployment county in the state starting, but health insurance was becoming almost as important, if not more important, the cost of it, than the wage you were paying. You were having fewer and fewer people come in to buy the premium down due to how lucrative it was to sell an insurance plan to a small business, even one up to 300 employees. In a nutshell, I said I'm not renewing the plan. It was costing me about $1 million back then. And even with buying the premiums down, raising deductibles, I still was not able to keep it under like a 3 to 5% increase each year. It would have been more like how lucky they told me I would have been that it's only going up 10 to 15%. It all got to be very annoying. So I said, what can we do to change? He said, well, you're right at the cusp of being able to self-insure. I said, I don't want to self-insure because I don't want to get that involved with offering that fringe benefit. They said, well, you're ignoring the one thing that can help you save money. Saved us 25% by taking the margin that they were making on our plan and becoming the insurance company. I said, well, the way this works in 2, 3, 4 years, premiums will go up again and I'll be right back in the same place. I said, what can we really do to fix and control costs? He said, well, you're going to save a lot of money if you do it, but you're going to have take a lot of guts to do it. And I said, I wasn't getting it that quickly. They said, your co-payments. I said, oh, the thing that everybody loves because it only costs them $10 when they mostly engage the healthcare system, office visit, pharmaceutical. I said, well, how much is that? That's 25% of your premium. I said, now we're talking, get it down. And then that sounded sustainable. I said, but gosh, I got to sell my employees on this. I had 2 quit and another 15 or 20 want to see what I was up to. And I'll finish with this. We did cut costs 12 years ago by around 50%. This is the part you're not going to believe. I've not had a premium increase since then, and I lowered families' contributions by 50% 3 years ago when we got the tax package through, because that to me was a generally good thing for enterprisers. I thought it was time to take some of those reserves we built up and give back to my employees. So that worked by doing the 2 things I mentioned earlier, 2 of them, not all of it, because we still have barriers to entry. We still have lobbyists that make pharma, insurance, and hospitals 2, 3, and 4 in DC. And I was naive enough to think the US Chamber of Commerce would be on my side as an enterpriser. They back, as the largest lobby, the 3 right below them in healthcare. Here's the other thing that happened. One employee who still works for me was really griping because he had a $200 a month maintenance medicine if you didn't have a $10 copay. So he was paying 10 times 12 months, $120. It's now going to be, or it was then going to go up to $2,400. And it was a tough conversation because my promise is I'm going to keep your premiums flat in the future, which I lived up to and did. And I said, by the way, have you ever shopped around for your maintenance drug? Why in the heck would I with a $10 copayment? Perfect answer. I said, humor me. Let's see if we can find it without going to Canada. Took him 30 seconds, found it for 99 bucks. It gave me literally the chills when I was standing there because I said, this can't be true in a place where you didn't think you had options, where you used a little bit of transparency. Well, now they do it on colonoscopies, CAT scans, MRIs that range from 700 to 3,000. And they're now choosing the value, not necessarily always the lowest price, but they're spending a lot less because they're an engaged consumer.
Well, with that, let me bring in Tevi Troy here because Tevi actually, when he was deputy HHS secretary, he was heavily involved in George W. Bush's health reform plan, which was about reforming the tax treatment of employer-sponsored health insurance, and then went on to start a trade association called the American Health Policy Institute, where he worked with the HR departments or HR executives of Fortune 500 companies. So this is an issue that he knows a lot about. Tevi, what's your take on when employers will basically throw up their hands and say, you know what, I'm tired of healthcare inflation. I'm tired of these costs going up 10% a year. We've tried to do the things that the senator is talking about, but ultimately we're still seeing costs go up. I'd rather have the government do it. I'd rather have individuals do it. Where's that tipping point in your estimation?
It's a great question, Ovik, and thanks for doing this. I've been watching the conferences all week and really enjoying them. Also, American Health Policy Institute is a think tank. I'm no longer there, but it's still in existence, and they do look at employer-sponsored care and how it's going. And while I was there, I did look at this question of tipping points. What is going to drive the employers out to leave them to give up? I think they are more stubborn in a way than Senator Rounds. Senator Rounds said he was talking about dropping out, and as a relatively smaller employer, some of them consider doing that. These large employers are very worried about the political fallout from dropping out. So there's a high resistance to them pulling out of the market. That said, there was a move, as you know, in terms of pensions to move from defined benefit to defined contribution. And I could see them starting a move in that direction. It would be similar to kind of what Paul Ryan was talking about in terms of Medicare reform, having some kind of premium support. But they're not there yet. One of the other reasons that employers want to stick with it is because they want to have a hand on the tiller. They want to feel like they have some control over their employees' healthcare because they want their employees to stay healthy. So they want to incentivize them to engage in good behaviors. And then also you have to remember the kind of bureaucracy that has arisen in these large employers. And they know that if they move to defined contribution or if they somehow step out, then all those middle manager folks who help run these systems will lose their jobs, and they'll be resistant to that as well. So I think for now, employers are still with the system. They recognize that there are subsidies, as you correctly noted for years, but they also know that they're spending a lot of money for their healthcare plans and that they're subsidizing their employees at the same time. And so I think the employers are griping at this point about the level of costs, but I don't think they're pulling out in the near future.
Well, we should note at this point that the Fair Care Act does two things that are pretty important in terms of reforming employer-sponsored health insurance to give the workers more choice over their health care plans. One, it does the George W. Bush reform of standardizing the tax deduction for employer-sponsored insurance so everyone gets the same tax break regardless of the value of their health insurance plan. Whereas right now, if you're a Wall Street investment banker, you get a much bigger break than everybody else, for example. Second thing it does is it requires that if you're a startup company, any new company founded after 2021 that wants to sponsor health insurance, you draw down the tax break not by sponsoring group insurance yourself, like Senator Braun's business did, or like a lot of the business you represented did, but by giving workers the equivalent amount of dollars to then go shop for their own health insurance. Those are two key reforms that you all put in this bill. And with that, let me bring in Mr. Westerman here. You've been working on this effort for several years now, and a big part of there are a lot of elements of this bill that drive down the cost of healthcare, try to tackle that problem, not just for people in the employer market, but all over the place. Tell us about your motivation. What led you to want to take on this problem and tackle it with this significant bill?
Thank you, Ovik, for doing this. It's an honor to be part of the panel and my colleague, Senator Braun, who's brought so much to the Fair Care Act. And, we've now got a bicameral bill where we started out with just a House bill with me being the only sponsor on it back in 2019. But I could tell a similar story to Senator Braun's from my days in private practice in a consulting engineering firm where we had 100 to 150 employees, and every year the cost of insurance went up and the benefits to the employee went down. And so right about the time the Affordable Care Act was signed into law and being implemented, I got elected to the state legislature in Arkansas. So I saw from the state side what it was like trying to implement the big federal law and a lot of the problems with that. And I think if you take the most offers from the Affordable Care Act, you see about 7% of the population that benefited from the Affordable Care Act. And I think the other 93% was forgotten about. But those private health insurance premiums continued to go up, the benefits continued to go down. And that's what drove me to want to make changes not only on the state level, but now here in Congress. And Ovik, I think it's been about a decade since you and I met when we first started looking at implementation of the Affordable Care Act on the state level. And after the American Health Care Act failed in 2017, I believe in a week or 2 weeks that I called you up and said, I'm going to do a healthcare bill. I said, I know we've shifted to tax reform, but we've got to do something on healthcare. And it was the engineer in me that said, how do we get to the end result and how do we reverse engineer this? And to get a healthcare bill that I believe can pass and get signed into law is going to be one that needs to be bipartisan, meaning it's got to get 60 votes in the Senate to do real reform. And to get 60 votes in the Senate to get past that cloture rule, I believe it has to be something that covers more people and something that lowers cost and something that covers pre-existing conditions. So that's the basis I started at. How do we work backwards and how do we find policy that's just good healthcare policy, not a repeal and replace act, but a bill that truly gives the American consumer more affordable cost and better coverage. And that's how we came up ultimately with the Fair Care Act of 2019. And it's gotten so much better with the changes that we've made in the Fair Care Act of 2020. And I think we've got a product now that's definitely partisan. We've identified at least 75 bipartisan policy pieces in the Fair Care Act of 2020. The preliminary numbers that we've crunched, CBO hasn't done a score on it yet, but we truly believe more people will get coverage. And we also believe that it will lower costs not only for the federal government and the taxpayer, but for individuals who are getting their insurance either through their employer or, as Ovik talked about, through the MediSave program that we've got in the Fair Care Act of 2020. You could actually get tax-free money from your employer, put it in an account, and go out and buy your insurance on the exchange. And then the insurance goes with you if you change jobs. Your insurance is not tied to your employer. I think that's a benefit for the employee and the employer in the long run. But we've even learned things from the pandemic, things about telemedicine that we've included in the bill now, a lot of bipartisan language around that. And I really believe when the country takes a serious look at healthcare and we decide to do the right thing on healthcare, that the FCA, the Fair Care Act of 2020, is going to get a lot of attention because it answers a lot of the questions that people are asking. It's just not as much in the headlines as some of the other discussions.
Tara, and by the way, before I ask Tara a question, reminder that if you want to ask questions here at Agenda 2025, you can tweet at us at #Agenda2025, or you can click on the Q&A box on the Zoom window and type a question in there. Tara, what are your reactions? You've looked at this bill. I know we worked together on reviewing all the technical considerations. What stands out to you? What are the parts of this bill that are interesting to you?
Yeah, well, there are lots of pieces to this bill. I think what stands out to me most is how comprehensive this legislation is. It really touches on everything across the board in healthcare. So I really applaud you all for the work that you've done. There's so many important pieces. I will focus on two things that I find very important, and that is hospital and provider competition and drug pricing. So hospital spending accounts for the largest share of healthcare spending in the US. It's nearly 40%. Physician spending accounts for another 31%. So just between hospitals and physicians, that's nearly 3/4 of all healthcare spending in the US. And we know provider spending is highest in the areas with the most concentrated provider markets. In other words, competition is key, as you heard the senator and the congressman talking about. And there are many policies and regulations currently in place that encourage consolidation. For example, the accountable care organizations and other, pay for performance policies, the 340B drug price discount program, the use of higher reimbursement rates for hospital-owned facilities. There also are policies that make it difficult for competitors to enter the market. For example, certificate of need laws, the ACA's prohibition on construction of new physician-owned hospitals. And also insurer competition is very important. The lowest prices are found in those areas where there's high levels of both provider and insurer competition. And this legislation addresses most, if not all, of these issues. For example, I'll just run through a couple, but it would implement site neutral payments. It would encourage states to get rid of con laws. It beefs up the FTC's ability to enforce antitrust rules. It would ban anti-competitive clauses in insurer and hospital contracts, and establishes a national all-payer claims database, and much more. So I think a lot of those policies would go a long way in increasing competition, which has proven to be the way to get provider prices down. Next, I'll touch a little bit on some of the drug pricing policies that are included here. Prescription drug costs account for a much smaller share of healthcare spending in the US, roughly 14 to 17%, depending on which source you use. But it gets lots of attention, as we've seen over the last couple of years. And I think that's primarily because prescription drug costs are much more salient. You're much more likely in any given month to take a prescription drug or several than you are to go to the hospital, right? And so I think for a lot of people, they're receiving a drug bill much more often than they're receiving a hospital bill. But secondly, I think people have kind of a misconception of how expensive drugs are, primarily because of the way that our insurance covers prescription drugs. Typically when you do go to the doctor's office or to the hospital, what you pay as a patient, your cost sharing it's a percentage of the net price, based on what your insurer has negotiated. Whereas with prescription drugs, most often you're paying your cost share based on list price, and you're not seeing the benefit of any discount that your insurer has negotiated. And so I think that also kind of skews people's perception of how expensive drugs are. But that said, there are many policies that do increase the cost of drugs, and we could do better. And so there are several, so I'll give you some examples. So the Medicaid best price and the 340B, they call for steep mandatory discounts in certain sectors of the market, but then that encourages higher prices elsewhere. There are rebate practices that encourage higher list prices to give bigger discounts, that benefit everyone in the supply chain except for patients and taxpayers. And the current structure of the Part D benefit has a mandatory discount in the coverage gap, which means the discount as a percentage of the drug's price actually decreases as the price of the drug increases, which is not what we want. So there's a lot of just market distortions There's also patent protections and exclusivity allowances that are important for encouraging innovation, but they can also stifle competition. So this legislation has numerous policies that would address many of those issues, including improving generic and biosimilar competition, increasing transparency in the 340B program, increasing patent transparency and reducing the number of times an orphan drug can have its exclusivity extended, and also reducing the ability of PBMs to use rebates to drive patients to more expensive drugs. I think all of those will go a long way in helping to bring down costs.
Great. We have a question from the audience here. What about academic medical centers? Academic medical centers in particular charge premium prices for routine treatments that patients could get less expensively elsewhere. How do we steer people or do a better job of steering people away from these high cost centralized tertiary referral centers? You talked about site neutral payment. Maybe that's one of the answers, but you tell me. I don't want to prejudice your answer. And by the way, I neglected to properly introduce you, Tara. Tara is the Director of Human Welfare Policy at the American Action Forum, which is a major think tank in Washington, D.C. Thanks again, Tara.
Yeah, thank you, Ovik. So I don't know that I'm necessarily an expert, on the various types of providers and whatnot, but certainly getting rid of some of the policies to encourage hospitals to, buy up the smaller clinical sites and whatnot, and increase prices throughout the region is one benefit that we would gain from increased competition. But also included in this bill is a lot of price transparency metrics, and I think that can help a lot. But one thing that we have to keep in mind with price transparency is while that's good on the surface, what's even better is value transparency. I think it was Senator Braun that really spoke about the importance of value. And it can be really easy to have the lowest price if you're offering a poor service, right? And so it's really about offering the best value. And so I would really like to see price transparency paired with quality metrics so that patients can really best shop for their services.
And we have a question on price transparency. The Fair Care Act does two major things on price transparency. It creates statutory authority for the Trump administration's regulations that require hospitals and insurers to disclose their negotiated rates. It also establishes, as you said, Tara, an all-payer claims database, which would create this not a public database that would be run by private parties, but a publicly sponsored database, you could say, to also serve as a repository of all these prices. And we have a question saying, well, why do you need both of those? Why do you need both that price transparency requirement and also the database to record all these prices? Is that redundant? Anyone want to take that question? Well, if not, I'll answer. The idea there, I believe, was you want to hit it from all sides. More transparency is good. There's nothing wrong with having a kind of a backup system, you could say, a redundant system for price transparency. It creates two different sources of data and thereby enables even more angles at ensuring that consumers and employers have the data they need to make intelligent choices in the way they pay for healthcare. One question we're getting here from an attendee is, given that President-elect Biden, or I'll call him President-elect, I know that that's a loaded question these days, that he supports a public option, and I think a lot of Democrats are hoping that they'd have a Democratic Senate to help produce a public option, which theoretically is possible if the two Georgia runoffs go their way. Obviously, a Republican Senate is not as interested in a public option, I would assume. Could the Fair Care Act serve as the basis of a bipartisan approach to health reform with a President Biden? What are your thoughts on that? I'll ask Senator Braun and Mr. Westerman to take that.
I unmuted, so you can hear me, right?
Yes, absolutely.
Yeah. Okay. That's a good question, because currently I don't see there's a lot of interest on their side of doing anything other than marching towards a one-payer system until I couch it in these terms. Well, wouldn't you want costs to be lower for even a one-payer system theoretically, and I don't think you'll get the industry kind of conditioned to go there without an extreme case of jawboning or leaning heavily upon you. You get the benefit by, I think, reforming the industry first, because we won't get rid of a lot of what we've currently got. In fact, it's more likely politically to end up with more public presence. But as we navigate towards that right combination of whatever is in place that you're most likely not going to get rid of, even with the Fair Care Act, you create lower costs for the government that pays for a good portion of our healthcare, and of course for the private sector. So, and politically, how does that play out? Well, they're going to need a few Republicans to come their way if we lose both seats in Georgia, which I don't think we will. But, and if we then, and I think there's more likely to get movement, sadly, by a few Republicans engaging with Democrats that are real serious about that as their main issue. The biggest issue I see with my side of the aisle is that we're still in the camp of protecting the status quo. Healthcare is not even talked about in terms of reforming it. And in the 6 months that we did have our sleeves rolled up, we couldn't even come together on doing something about surprise medical bills. And that's got to be the lowest hanging fruit of anything. And that was an argument between providers that wanted to be able to go to arbitration, and insurance companies that wanted to set a price of averages. So I think you'll have squabbling within the current delivery system, and more conservatives, more Republicans are going to have to recognize healthcare as the number one issue, and then be willing to do all the things we espouse across all other sectors of the economy, the 3 or 4 things I mentioned earlier. Politically, the Dems want to do it, but they aren't necessarily interested in reforming it. So it's going to be up to guys like me to try to engender movement one way or the other.
You know, we got a question here. Tevi, you wanted to jump in on the public option, so you go ahead and then I'll ask the follow-up.
Yeah, I wanted to jump in more on what the Biden administration's like to do, which entails talking a little bit about the public option. But I think the public option in the current configuration is a non-starter. I think politically they cannot get it through the Senate, even if the Democrats win both houses in Georgia. Because if you remember, they couldn't get it through the Senate back when they had 60 votes in the Senate under Obama. So I just think it is a non-starter and extremely unlikely. I also think it's extremely unlikely to get major legislative change in healthcare, a la Obamacare, or something that would reform it in the short term. That doesn't mean we shouldn't be engaging in this Fair Care Act conversation and getting as many co-sponsors as possible so that we can move towards a bipartisan alternative. And I'm very encouraged by what I see in the bill. But in the short term, what I think the Biden administration is going to do is going to be looking at regulatory approaches, what they can do on Obamacare. And it's a real open and very interesting question of what they're going to do, because what the Trump administration did was create some more flexibilities within Obamacare. Now, remember, Republicans don't like Obamacare, but they like to give a little more flexibility, such as you can buy the short-term plans, for example. And you know, we know the individual mandate penalty is now gone. So, and we've heard less noise about the problems of premium hikes under Obamacare. That seems, it seems like some of the Trump regulatory steps may have worked. If the Biden administration's regulatory approach is just, we hate everything Trump did, let's undo what Trump did, that could lead to some restrictions on Obamacare plan, and it could lead to seeing premium hikes going up again.
A question we have that's related to this thread of the conversation is the Fair Care Act has about a half dozen co-sponsors, I believe. What are your plans on both sides of Capitol Hill to increase the number of co-sponsors of the bill? Who are you talking to, or you don't have to say who you're talking to, but how are you approaching your colleagues in each chamber?
You know, I'll take that one first, but I think we're going to see quite a few more House members sign on to the Fair Care Act when we get back to DC and get in session. I've already had some others contact me and tell me they want to sign on to the bill. But I think the Fair Care Act is uniquely positioned when we start talking about a new approach to healthcare. And as much problems as a public option would have in the Senate, regardless of the way the Senate goes, it looks like we could end up 214 to 221 in the House, which I think a public option would have a hard time even getting out of the House, because there's some members in the House that think a public option doesn't go nearly far enough. You know, they're more of the Medicare for all. So if you've got something that that you can get a large block of Republicans and a large block of Democrats to support, a la a bipartisan bill, I think if you could get that out of the House, that would put pressure on the Senate to do something as well. Now, I know from what I've read about the arguments at the Supreme Court on the constitutionality of the Affordable Care Act, it sounds like they may not strike that down, but it's still a possibility that that would happen. And the Fair Care Act is structured such that we could lift the language Affordable Care Act that we intended to leave in the law, put it into the Fair Care Act within a matter of weeks, and have a total replacement bill as well. So right now it's a bill to fix the system and to keep with the things that are good in the Affordable Care Act, like we take the exchanges and we actually make them much stronger and much larger. We protect pre-existing conditions. And, you know, I think if people will really take a serious look at this Fair Care Act, they'll see that it's truly a bipartisan bill that's focused on getting better health care at a lower cost for all Americans.
As you said, Senator Braun, another question we got here from Joel White. In general, historically, politicians have not wanted to take on the healthcare industrial complex. These are trillion-dollar industries that throw their weight around. They're large employers in a lot of congressional districts, a lot of states, including your state, where Eli Lilly is headquartered, and of course, a number of large hospital systems. How do you, how have you all, I guess for both of you really, this bill does do a lot of things to try to reduce the cost of healthcare. How have those conversations gone when you meet with people in the industry and they find out what you're up to?
Yeah. So when I became a state legislator in 2015, I had 3 bills: the general transparency bill, one to mark the private pricing through insurance alongside with the Medicare reimbursement, and then the one that helped me put these 3 ideas together to say it would really blow up the system, and that was to do what we're going to do here, and that's expose the secret deals between insurance companies and providers. Couldn't get a hearing for it back in 2015, and it's because the phone rang off the hook with everybody you mentioned and more. Found out in 2017 when I left, decided to run for Senate, they all invited me before I got out of Dodge because they knew it was an issue that they couldn't keep just sticking their head in the sand on. They wanted to meet with me, and everybody was there that's a stakeholder in Indiana in a meeting that wasn't public. Well, this year we got the first bills across the threshold that were anywhere from mild to maybe not what I had out there. None of them like it, but they all nod their heads when I'm talking to them because they know that something's got to give. The biggest thing that would help the dynamic in my mind is that the 80% of the CEOs that run companies outside of healthcare, we are the real stakeholders. We are like dummies that keep paying the bills through our private insurance programs, don't bring it into the C-suite, don't do what I did 12 years ago. That would start to turn the heads of Mitch McConnell, chairs in my conference that are beholden to that presence, that economic power you're talking about. So ironically, the group that's done the most work on that is in the place that's the most liberal, would be California, where they put a heck of a employers group together that I've met with. That ought to be the lobbying unit, which is comprised of all companies other than in the healthcare business, to get in there and start bending the ear of Senate Republicans. Bruce is farther down the trail than we would be. I don't know that I can get one co-sponsor on it, but it wasn't fleshed out until just a few weeks ago because of that apathy and that fear.
Mr. Westerman, you want to
Yeah.
take that on as well? How's it been for you talking to the healthcare industry?
It's actually been a pretty good experience, Ovik. And, I think the reason it is because when you sit down with the insurance industry or hospitals or people in pharmaceuticals, and you realize, or you're able to explain to them that, we're not singling out one sector here and going after, all the savings in one sector. We're trying to do something that's fair to consumers, that's fair to businesses. And also when you look at the alternative, if you're an insurance company and one of the alternatives out there is Medicare for all, or, a fully government run system, that doesn't seem too appealing to you, but something that keeps a market system in place that focuses on competition. That's how these companies were built in the first place. And I think they realize they can adapt in a system that's fair. And in the end, it's going to be better for everyone if we can do something to get these healthcare costs under control. So I haven't had the negative reactions that you would think we would get by filing legislation like this. We're going to break up hospital monopolies. We're going to break up insurance monopolies. We're going to force price transparency and do things to get the market more involved. When you start talking about site neutral payments, which I know that was discussed earlier, you really get a lot of value when you allow ambulatory surgery centers and outpatient hospitals to do more procedures than what are being done there now. It's more value for the patient. And those are the kind of things that we have to make the hard decisions on and push forward with if we truly want to make healthcare better.
One thing I'd observe from my seat is that you've been at this, of course, for a couple of years now. The first Fair Care Act was just you, but you've had that opportunity now over the last almost 2 years to walk your colleagues through the bill, and that's how you got those half dozen co-sponsors, and it sounds like more to come. And presumably, Senator, that might be your experience as well over time. Especially, it seems to me, as members realize that you live to tell the tale, right? You put this bill out there, and you're still in Congress, you're still doing your thing. So that seems to be, at least from my vantage point, something that's encouraged other members to get involved. One question we got, I'll swing it back to you.
Ovik,
go ahead. Yeah.
I was just wanting to add to that. I've not only talked to Republican members, I've sat down with Democrat members in the House, and I've gone through the Fair Care Act, and they're not by any means ready to sign on to the bill yet, but they nod their head and say, yeah, these are some of the things that need to happen. And especially when you call up a Democrat member and say, hey, I saw you've got this bill that does X, Y, or Z, and we're writing this Fair Care Act, and your language actually fits right into the bill that we've got. Would you mind if we took your bill and put that language in our bill? I think that's a way to, cross those borders and get people to think, maybe they do want to do something that's good for everyone on healthcare.
That's a great point. I'm glad you brought that up. I want to swing it back to you, Senator Braun, because we have a question from the audience about state-based reform versus federal reform. What's the role for each? And I want to ask you this question because Indiana actually is a state that really had a major effort in its last legislative session, probably will have one in the incoming 2021 legislative session, trying to reduce the cost of hospital care that presumably you've had some, you've been able to look at from the side, from your seat, compared to what you've been trying to do at the federal level. What do you think about the role of state reform versus federal reform when it comes to healthcare?
I think you do both. And I've got more optimism that we can pick away at it state by state. I think a place like Indiana that sports either the highest or second highest hospital costs has got good motivation to do it. Finally, we got a few of our business leaders recognizing that what I said earlier, we pay all the disproportionate share of healthcare costs through the private insurance component of healthcare payments. No, I think that it is so, I was a legislator at the state level for 3 years, and we got through a major infrastructure program that actually raised user fees or gasoline taxes. I viewed it as an investment in the sense you've had something tangible. Being one of the more fiscally conservative individuals in our state legislature, found a way to do it and sell it. And same way here in the Senate. But I do believe that the logistics are a lot simpler. And I think you run into less pressure because most people at the state level aren't there for as long a period as many want to be in the US Senate and the House. I think you have a lot more calculations in terms of how aggressive you want to be once you get to DC, where I think you're a little more interested in maybe other considerations when you're a state legislator for the average state legislator. And that's why I'm more optimistic that we might accomplish things at the state level that then could be compiled in a way based upon the laboratory of doing it in different ways there to bring it to the national level. The biggest fear I have is the political cascade that we are so close to, of where the Bernie plan just envelops everything. And once we go to where government's presence gets a whole lot larger than what it is now, I think it'll be viewed more like regulating a utility than it would be keeping the agility and some of the good things that we have in our current system in place, but just drawing the cost out of it. And I think it'll be similar to many other systems across the world that view healthcare almost like a utility. And we're so close to that currently that I don't know that we have enough time, since the industry is being so stubborn about embracing market reforms. Bruce is maybe, I think when I hear him actually being kind of benign in what you're saying in terms of their reaction to it, is because they don't think it'll actually ever get anywhere. And I'm a believer that they control their own destiny. And now I think they almost gamble on having the government as their main business partner rather than the rigors of the marketplace. And I don't like to use marketplace either. There's nothing that resembles a marketplace currently with healthcare because of the lack of the four things I mentioned out of the gate.
Yeah, you're bringing up a point that's interesting, which is that the to the degree that the hospital industry or other industries don't object to the pro-competition measures in the Fair Care Act, the alternative on the table right now is a public option or Medicare for all or some other system that's much more aggressive in the government dictating what prices you can charge or not charge. So if you're going to kind of dig your head, put your head in the sand and just say there's no problem, we're going to just raise prices 15% a year forever, then there's going to be a reckoning one way or the other.
And you know why?
Can I jump in on this?
Yeah, go ahead.
So look, I think the state versus federal question is very important. I strongly agree with what the senator said about how we're on the cusp of this becoming basically a public option or a Bernie Sanders type system. But there are things you can do at the state level, and I applaud them. I like what Mitch Daniels did in Indiana, but there's so many things that have to be done at the federal level, the way we are currently configured. Medicare, it's a federal set program. The tax breaks are coming from the federal government. Even Medicaid, which is supposedly state-based, there are so many restrictions and mandates from the federal government that I think will be worse actually in a Biden administration than they have been in the most recent years, that it requires and necessitates reform at the federal level in order to do what we need to do in order to make it have a system of state experimentation and state laboratories.
Senator, you wanted to say something.
Well, I think honestly that the industry currently would rather wrestle with the government than wrestle with one another, because they've grown up with most of their current form in what I call having the benefit of being like a utility with no regulation on pricing, because there's not a pricing commission. That's only done with the analogy of what you see in Medicare. But since so much of it can then be recouped or recovered through private insurance, they're really gaming the system. And I'm wondering if they do not make maybe the honest calculation that they would fare at least as well either way, and probably wouldn't have to change their paradigm much to just go more towards a one-payer system than robust competition.
Tara, I want to bring you in here. You know, you spent a lot of time thinking about this question of what is a market-based approach to universally affordable health insurance, universal coverage. Why is that important? And now that you have this broader role at AAF where you're looking at all kinds of welfare policy, what's your assessment of the value or importance of everybody having health insurance?
Yeah, well, I mean, it's incredibly important, particularly as we're seeing now, right, in this pandemic. I mean, yeah, in my current role, I've kind of expanded beyond looking just at healthcare and looking at all of the various aspects of life, you know, policy that influence someone's health, whether that be your nutrition, your housing, the air you breathe, the water you drink, right? Like there are so many things that impact someone's health. And so having health insurance and affordable health care is very important. It's certainly not the only thing that determines how healthy someone is and the life that they're able to lead. And so I think all of the things that we're, you know, doing in this bill that can help reduce costs and improve insurance affordability are very important. You know, something we didn't really get into the details of this bill, but the way that subsidies would be provided based on both age and income, you know, I think is a really important change, and it would allow subsidies to go to people at a higher income level than what is afforded under the Affordable Care Act. And I think that that's really important, and it kind of rebalances those scales, and it does make it a more progressive benefit, and it extends the benefit to more people. So I think that's really important.
Senator Braun, you're a first-term senator. I think you came in January 19, if I recall correctly, and Mr. Westerman, you came in I want to say 6 to 8 years ago now. It's a bit of a blur. Have either of you worked
15.
15 years in Congress? My goodness.
No,
time
in
flies.
2015.
Oh, 2015 you
Elected
came in. Okay.
14.
Right.
Yeah.
Yeah. So I was just curious if either of you had any spent any time with Mr. Biden. Do you know him well? You know, he was obviously in the Senate for a long time, but that was before your time, Senator Braun. I just wanted to get your sense of if either of you know him, if you have a sense of whether he would do business with Republicans on healthcare.
I'd have to say very briefly, I do not know him. I've not met him. So my sense is Democrats are more apt to bargain than Republicans because we're almost totally disengaged on the Senate side. And we do have a committee change at the Health Committee. Richard Burr from North Carolina is likely to take over for Lamar Alexander. And I think whenever that happens, it's an opportunity for a little dynamic change. And the other guy that's been most vocal has probably been Chuck Grassley in finance, mostly on pricing issues. And then ironically, you know, Trump has been the most reform-minded through executive orders, and none of which hit pay dirt because the industry takes them to court whenever they go out. So I'm thinking that Democrats, this is their number one issue. It's not the number one issue for Republicans. So I think if they push it, that's where our Fair Care Act might come into focus, as getting a few Republican votes, you know, if they can get a hearing in the Senate on anything.
Yeah, great point. Especially if Republicans have the majority, that will be the
Exactly.
interesting dynamic to follow.
Yeah.
We got a question about something I said, which is your principal slide referenced Medicare Advantage for All. Is that a shortcut way of thinking about the Fair Care Act? Yes, I'd say yes. And the basic point is Medicare Advantage is in a sense the way Obamacare was sold. It was going to work like Medicare Advantage in the way that in Medicare Advantage, seniors choose their own plans among dozens of choices. Those choices are affordable. They're competing vigorously on price. Customer satisfaction or patient satisfaction with Medicare Advantage plans is extremely high. We're at now over 40% market share for Medicare Advantage private plans in the Medicare program, slated to go up to 50% by the end of this decade. So our basic point in describing it as Medicare Advantage for all is twofold. One, to say, let's have the rest of the system work that way. Let's have employer-based coverage work that way, where workers choose their own plans the way seniors do. And let's reform the Obamacare exchanges so they work as well as Medicare Advantage, where people have a lot of choices and high quality choices that they actually are satisfied with in the way they buy their insurance.
Ova, can I jump in quickly on that
Yeah.
point, which is, I think the questioner has a good point in where he says, is this a shortcut way of describing the Fair Care Act? Because I think, speaking to you and Senator Rounds and the Congressman, that you do need a shortcut way of describing the bill. It is so comprehensive that it's hard to do it in a postcard and explain on one leg what the bill actually does. So that's one thing. And the other thing I would warn you in my years of writing about this, and in particular criticizing Obamacare, is you've got to worry about fear. What will people fear from this bill? And if you can identify what the fear is and find ways to mitigate it, and B, argue that it's not a fear. And when I say fear, you think about the Republican bills ran aground because there was the fear of people with pre-existing conditions not being covered. Obamacare, the fear was about the people in the individual market who are going to lose their insurance, which was a true fear, and that the premiums are going to go way up, which is also a true fear. So you've got to find a way to address the fear that people will have when this bill comes out, and people are looking at it seriously.
Well, that's absolutely right, and I can tell you, Tevi, and we'll see over time whether this actually bears out. But I can tell you that Mr. Westerman, Senator Braun, all the people who worked on this bill put an enormous amount of thought into that to ensure that in every possible case, patients will come out ahead, regardless of where you get your health insurance. Now, you could say, well, how is that possible? That sounds like a free lunch for everyone. No, it's not a free lunch for everyone, because what the bill does is it reduces subsidies for the wealthy, as we alluded to earlier, and it also reduces the cost of healthcare, which means, the industries that benefit from the high cost of healthcare today are not going to be as happy about the way this bill works necessarily. But those are the things you have to do if you want a system that covers more people and offers affordable coverage to everyone in a way that's fiscally sustainable. So that's the rub of it. And again, we'll see over time in this new Congress whether that comes to bear and how this all develops. We're out of time. I just wanted to, since we've got these great members here, I want to say, if you have any concluding remarks, Mr. Westerman, Mr. Braun, fire away. What would you like to say before we let everyone go today?
Thank you for having this forum. I think it's been an engaging conversation. I'm gonna, as long as I'm in the Senate, I'm gonna make this my top concern. The thing that disappoints me most about my new employer is how slowly things materialize. I asked how long it took to get the criminal justice reform bill over the finish line. And I was thinking maybe 5-6 years. They worked on it 10 to 12 years, and mostly because they were running out of prison capacity was probably that overriding. So often we solve things at the federal government level through crisis. That's why I'm more optimistic, even though it would have a lot more impact if this was done federally, that we may have to settle on trying to get things at least started at the state level. But I think most of the onus is on our side. And I think the big, kind of a factor that bothers me is that at some point you're going to lose the 80% of the CEOs that currently would probably rather have the system reformed, where they're going to say, I don't care anymore. This should be between the individual and government. Take us out of the middle. And when that occurs, I think you've lost any chance for reforming the system. Then it'll be whatever you work out, like most other countries have.
Great. Mr. Westerman.
Yeah, and Ovik, also want to say thank you for having this forum. Thank you, Senator Braun, for all the work that you've done getting a Senate version of the Fair Care Act. And we knew this was going to be a long haul when we started this work. And if I'm going to work on something for a long time, I want to have a really strong foundation and a good position to work from. And I think that's what we've got with the Fair Care Act. It will take time, and you never know when those opportunities are going to come along, especially in Congress, where things just fall in place. But I know we've got to have a good piece of legislation as the basis so that when people start looking at it, they're going to say, you know, I can't really find the problems with this, or maybe here's the place we need to tweak it. And also through this process, I want to say thank you to a lot of people who are on this virtual webinar who have given us so much feedback and input. There are a lot of really smart people in this country that understand this problem. And the fact that you've taken an interest in this kind of legislation and you're giving us feedback, that's invaluable. So I say we just have to stick together and have a long-term vision here and keep our eye focused on where we've got to get to, and someday it's going to happen.
Thank you. Tara Hayes, Tevi Troy, Bruce Westerman, and Senator Braun, thank you for your time today. You're all so busy. I really appreciate you doing this. Thanks to our audience as well. Next week, we'll be back with 4 more sessions for Agenda 2020, the last 4 sessions of Agenda 2025, starting on Tuesday. Same time, 3:30 Eastern for each session, same Zoom URL link. You can find the whole schedule at agenda.freop.org. I'm Ovik Roy, the president of FreeOp. Thank you all so much for joining us. Bye.
Thank you.
Bye.